Mesothelioma is a malignant tumor of the outside lining of the lungs and the inside lining of the chest walls. It also can occur in the abdomen, around the bowel, or in the peritoneum, which is the inside lining of the abdominal wall. Principal cause is asbestos, the inhalation of asbestos fibers or the swallowing of asbestos fibers. These fibers then get transported out to the surface of the lung or out to the surface of the bowel, and over time, over many years usually, they can occasionally, rarely, result in this malignant tumor, mesothelioma. Nearly all of the asbestos-caused diseases, the scarring in the lungs, the lung cancer, the mesothelioma, all take many years to develop. The asbestos fibers slowly but surely irritate the lung or the surface of the lung over many years, and eventually can lead to things like scarring or lung cancer or mesothelioma. Unfortunately, it still is a very bad prognosis. Most people do not survive beyond a year when this diagnosis is made. The people with the mesothelioma in their abdomen seem to do a little better with the disease than the people with the so-called pleural mesothelioma, which is inside the chest. We're still seeing a pretty steady stream of people with mesothelioma, unfortunately. We had hoped it was going to go away, but we're still seeing more of it than we'd like. And most of the time their exposures occurred many years ago, 30, 40 years ago. That's a good question, and no one really knows the answer to that. We had hoped that we would see it peak in this decade, and that, again, it would begin to fall off. But so far, in my experience and the experience of others, it continues to occur. As asbestos is being used less frequently, sometime in the future, our hope is that we'll see less of this mesothelioma. One of the reasons I think we're continuing to see the disease is people are living longer. So as they live longer, they're more likely to develop it. And as longevity increases, you know, it may be 20, 30 years before it really begins to go away. If we hadn't used it, we wouldn't be seeing all this disease. Unfortunately, asbestos has some very useful properties. It's a great insulator, a great fire retardant. It's been useful in ships. It's been used since antiquity. The Romans, the ancient Romans, used it to fireproof their ships. So really only in the last 50 years, I think, have we begun to really get serious about the dangers of asbestos. And I think really only in the last 20 years have we begun to really try not to use asbestos and to be careful with it when we take it out of buildings or other places. But in other countries, it still continues to be installed and continues to be used, and pretty widespread. If you take a good occupational history, which most physicians don't do, unfortunately, you find that anyone who worked in the construction industry, anyone who worked in heavy industry of any sort, automobile mechanics, all of these people, if they've done it for 15 or 20 years, have had significant asbestos exposure. In addition, we see mesothelioma about 15% of the time in people who have what we call bystander exposure. These are typically wives who had husbands who worked in industries where they had asbestos exposure. The wives would shake out the work clothes and launder them, and unfortunately a few of them have gotten mesothelioma. We don't really know why some people get it and some people don't. There's probably a genetic interaction there that some people are more prone to get it than others, because as you pointed out, a lot of workers don't get it. There may be 2,000 or 3,000 cases a year total in this country, but the great majority of those cases occur in people who have had significant asbestos exposure.